Hello everyone, this is Dr. Anuja, and today we are going to have a little talk about MRI. So, how many of you had suffered from a severe back pain and you were unable to move, unable to change your side, and might be you thought to have an MRI? So, is it really necessary? And if yes, then when? So let me start with what we can see in MRI. So MRI generally shows our postural and structural related changes, like we can see our foramina, our disc, facet joints, and nerve roots. And if you go to a physiotherapist, then a physiotherapist can physically evaluate you. We perform some physical test, and even we can tell you all these postural and structural related changes, like we can tell you at what level you have an injury, which nerve root is compressed, and everything. And along with this, we can tell you your muscular strength, your joint mobility, flexibility, balance, and any changes related to your muscles and joints. And physiotherapy assessment will cost you around 500 to 700, and a MRI could cost you 7,000 to 10,000 also. So my advice is, first you should go for a physiotherapy assessment, and then if needed you can go for MRI. Because sometimes what happens, with growing age there are some changes are common, like our disc degeneration, like getting an eyesight, getting wrinkles. So disc degeneration is also common. So if you have a problem related to your muscles and you get an MRI and their MRI will show some changes in your disc, then your line of treatment may get changed, you know. So I think this should not happen. So it's better to evaluate yourself first physically. So when you could go for MRI, if you had an accident, or if you have some chronic type of injury like pain from so many years, and in acute injury also, if there is any nerve injury, like if you have a foot drop, then you can go for MRI. And along with this, if you have a cardiac vena syndrome, in cardiac vena you can lost your bowel and bladder control, like you don't know when you are peeing or defecating. So in that case, you can go for MRI. So I think this video is helpful, and if you have any further queries you can ask me. So just stay healthy, stay fit. Thank you. Bye bye.